we're here to continue our conversation with Nara, and I want to bring up something that's incredibly frustrating for me as a sex educator, seeing that I have been doing this for a very long time, and I remember the days before HIV. The myths that still exist in 2021 just blow my mind. So Nara, if you could just talk to us a little bit about what myths you're still hearing about HIV, and then anything else you want to share in that ballpark.
You know what? I think the very first thing that I think of is one of the first lessons I personally learned getting into this career when I first started. So when I first started, I was about 23. I was a spring chicken back then, and it was really interesting. We had a patient that came in and HIV positive and kept on getting STIs, and we're like, well, why aren't you using condoms? And they're like, well, why do I use a condom if I'm having sex with someone else who's also HIV positive, right? So, and I think I stopped and my face went like white, and I was like, okay, let me get this straight. So you're telling me that you guys have disclosed to each other that you guys have HIV, and you guys are having sex, without a condom. And they're like, yeah, what's the problem? So then that is when I went into the whole resistance profile. So we are right now in the age of COVID, and everyone knows about different variants, mutations, right? And oddly enough, COVID-19 and HIV is very similar, right? Like, I mean, COVID is, you can get it through like breathing and coughing in the air, and HIV, you can only get it through bodily fluids and blood. But, I had to really educate him about, hey, HIV also mutates. So I gave him a perfect example of, I have nothing against Rottweilers, right? I think they're gentle, cute little doggies, but we have this thing called the poodle virus and a I can't even speak today. a vicious dog virus. And if I were to have a virus that was had no resistance, so that means that the medication that that is available, they could, I can take any kind of different cocktails. But then Sabrina could have a different type of HIV that has a lot of resistance, and so to different medications. So she would be very limited in the types of medications that she could be on that would be as effective. So if these two people, were to have sex, if I had a quote unquote good HIV virus, right, quote unquote, then I could actually get reinfected with a different type of HIV. And that is like a big myth. And also even with teenagers, like, when you really think about it concretely, yeah, if I have HIV and you have HIV, we could totally like get married and have kids, or like we can have unprotected sex and it'll be totally fine. But knowing the nuances of how this virus affects the body and how it mutates and transfers, that's a huge myth that I feel like I started realizing I need to tell this to all of my patients that come through, because I was like, I wonder if all of them also think that. So that was a big one. And then I think another one is, obviously, like I've been in numerous clinic rooms when we've had to disclose their status. So the HIV diagnosis to the patients. And, the first thing that, people think of is, I'm going to die. That's it. Like, my life is over. I'm going to die, and a lot of our female, their first thing is, am I going to be able to have children? Am I going to be able to get married? Or, and that's like the first questions that they come up with. And by all means, your life is not over. Technology and medication has come a really long way. And, you by now, like, you can take one pill once daily, like kind of like a vitamin, you take it in the morning and you have to take it every day. around the same time, and then you keep it moving. And I think a lot of times, like, we tell them you could be HIV positive, get married to someone that's negative, and have negative babies. And there's this huge movement called U equals U, which is undetectable equals untransmittable. And this was there was a huge study that was done with different diagnosed couples. So one of the couples would be positive, and the other partner was negative. And they did this study, and they found that if the infected partner took their meds, remained undetectable, which means the amount of virus in your body is so minuscule that it's undetectable with a machine, right? That there were zero, I say zero again, zero transmissions between those couples. And so that just shows that, it's not a cure, but it's a medical cure, right? You're able to manage it well enough to the point that you can have a perfectly normal life. Obviously with medications, always going to be side effects. But, with that being said, you can live until 80, 90 years old with HIV and, have a great thriving life. And I think the third thing that comes up a lot with me is people say HIV is not a big deal anymore. Oh, that was like, that was in the 80s. Or, when I do a lot of outreach for our PrEP clinic, and I try to tell them that, it's still a epidemic in the District of Columbia. And we are basically number one in the entire country. It's 1 in 12. 1 in 12 in DC, the fact that you have the chance of getting infected, like that's really high. Like I think we're right under Rwanda in Africa. And when I tell people that, you can tell in their face, their brain is like blowing up, being like, are you just messing with me? And I'm like, no, this is not a laughing matter, and I would not joke about this. And in a lot of ways, HIV has come so far in medication and technology that it's actually more manageable than diabetes. Obviously, if I were to tell people, oh, I have diabetes, it doesn't have the stigma that HIV does, even still now. But I think in general, like, people need to know that this is still an issue, and it's not. And it's really affecting our youth. I think the youth in DC has double the rate of infection than the national rate. So these are kids from the ages of 12 to 24, that are coming through my doors, and it's like, we are into 2021 right now. We should not be having newly infected kids, and that still really pains me. And but at the same time, the work doesn't stop.
And I think that stigma is so important to talk about, because even I know that when I'm working with college students now, when we're talking about getting tested, they're hesitant to get tested because of the stigma with HIV. I'm like, but it's one of these things, what you were saying before about more manageable than diabetes, yes, but they have to get tested, they have to get diagnosed before we can get them into a management care plan. And I think that stigma just stops that from happening as soon as it could. So.
Yeah. And I think a big takeaway for me too, all of these myths that you shared were like, for me, especially because I'm not necessarily as aware as you and Dr. Sue are because of the work that you have done in your careers, but it just brings for me so much awareness, even just in those different variants. Like, I know you've told me before because we know each other outside of this YouTube channel, but the first time that you had shared that with me, I'm like, oh my gosh, wow, like that makes so much sense. And like you said too, there's just so much more work to do. And I hope that through this series, I would assume a lot is education, right? Because even with the previous conversation that we had, where you're in like Uber rides and you're talking to people who have PhDs, and it really, at the end of the day, it doesn't matter how educated you might be formally. Like we all, I think, have major opportunities to be able to have safe, healthy, normalized conversations around sex, sexual health, sexual dysfunction, all of these things. So I'm excited to continue the conversation. And so stay tuned.